Hello there. Welcome to our vodcast on simulation education. I'm your host, Shane Aiden Gravel, and today's episode is What does simulation education in medicine look like? I'll be showcasing the various levels of fidelity currently in use, along with some variations on the cutting edge of medical simulation education. So, what does simulation education truly look like? Well, depending on where you are, some of you might be familiar with low fidelity simulation education. If you've recently taken a CPR class, you might have what is known as a rescue Annie. That is a task trainer used to help with compressions and how to do mouth to mouth CPR on a simulated patient. Um, when you get into the higher level education, a lot of medical schools are now moving to mid fidelity and high fidelity. High fidelity is going to be the more expensive of the two, where you can do all of the things. For example, here's a video where we see a team of first-year medical residents. They all recently graduated medical school a month ago, and they are all in a family medicine practice. Here we are showcasing how they are doing team dynamics, closed loop communication, and working through both the cognitive domain, the psychomotor domain, and the affective domain of education. So, what is experiential learning in the interprofessional setting? Well, here at Prisma Health, USC School of Medicine Sim Center, we do a lot. We work with the gamut, medical students to medical interns to medical residents to attending physicians, respiratory therapists, nurses, obviously, um, pharmacy, radiology, you name it, they all come in. And we work in a closed loop group where we actually work on team dynamics. You're probably wondering what are team dynamics? Well, that's where we discuss role assignments. We talk about mutual respect. We talk about closed loop communication, where we work through verbal order readbacks, and we try to trap any communication breakdown errors that might lead to issues or the detriment of the patient. This is where error trapping comes in, the last on the chalkboard, and this is where we talk about a lot of shared mental models, very big, especially with the adult learners, according to Malcolm Knowles, who coined the phrase andragogy. A lot of folks come in with their own understanding of how it should be done, and sometimes we're not on the same sheet of music. So making sure that we trap any errors prior to that mistake making its way to the patient, in essence, creates a safer environment for all involved. So here, I'm just sort of having some fun. The video on the top left, I like to tell everybody that I work with dummies or that I play with dolls, both of which would be correct. On the right, you can see a storage rack of some of the various pediatric simulators that we currently use. From a cost perspective, they are anywhere from 20,000 to 35,000, depending on what type of fidelity you would like. But when it comes to the return on investment, if you think about it from a theoretical standpoint, we are hopefully preventing medical errors, whether there are simple medical errors or costly medical errors such as unexpected death. You've got to think that $25,000 investment into preventing those injuries to true living human individuals is definitely of value. In terms of users, obviously we use these with nursing, we use these with emergency medicine, we use these with pediatrics, we use these on a variety of end users. So it does spread out nicely. So the big three, these are the big three manufacturers in high fidelity simulators. For those of you who do CPR class, for the last 60 years, Laerdal has been the provider of the Rescue Annie simulator that you are probably familiar with using. But if you are getting into the career field, you would like to become more familiar with Laerdal, Gamard, and CAE, as they are the big three. Think of them as the Burger King, McDonald's, and Wendy's of high fidelity simulation. So a little pop quiz. Take a quick look. Is this real or fake? This would be a Gamard product. This is Supertory, and as you can tell, she is a hyper-realistic simulator. This allows for intubation, compressions. It has pulses, it moves, it blinks, it breathes. You can control all of its vital signs to manipulate the scenario. If you think about this, this is perfect for high fidelity sim training. Moving away from the high fidelity simulators, we have something called task trainers. Task trainers are specific to a specific task. So for the sake of this conversation, we decided to go with Central Lineman. He is specific to placing central lines. He has a ballistics gel. He is ultrasoundable, so he will present just like a real human being with vessels and vasculature that would project on a ultrasound machine, and you can cannulate him and get blood work back and the like. This is really great. He's about 16,000, and he is superb in helping to show best practice for placing them and for wound care management. The last piece we're going to discuss is standardized patients or human actors playing a role. In this video, if you click the link, she will demonstrate a third trimester vaginal bleed. It is very apparent as to there being a medical emergency, but adding a standardized patient allows for the learner or student to actually not only manage the medical case, but the psycho and emotional state of the patient. And this has been really great at helping our young folks who are not as comfortable communicating with patients to develop that skill prior to starting their residency. With that, I'm going to say thank you so very much for your time and efforts. I hope you enjoyed today's video. My email is listed below, and I hope you have a great day. And on that note, go Cox.